challenges in moving it from place to place in a special box with dry ice. We will have approximately 84,800 doses and expected for this first phase. And already before I even left Atlanta to get here today, all those doses are already allocated to hospitals and public health facilities across the state. We're also expecting Moderna vaccine, which we hope will be approved as early as the end of this week, both by the FDA and the ACIP, to come next week with almost 174,000 doses. So that vaccine was actually tested here in Georgia. Some of you in the audience were part of those vaccine trials. It doesn't require the same kind of logistical challenges that the Pfizer vaccine does, and so we will be sharing that often with rural facilities and those facilities that don't require larger dosing, as it comes in tranches of 100 vaccine versus almost 1,000 in the Pfizer vaccine. Most long-term care facilities, like another priority target for us, will be actually vaccinated by CVS and Walgreens in a special partnership that was developed by the federal government. And we are really grateful for their partnership in this. And they will carry out that work very shortly. We signed the agreement today and gave the go-ahead, and they will be moving forward at the end of December or the first part of January. And so we'll be seeing that roll out to 95% of long-term care facilities, initially skilled nursing homes. Reminder that everyone needs 2 doses, not 1, which again makes this both these vaccines, both the Pfizer and Moderna, even more complicated, and requires even more complicated logistics. And we will have already developed reminder systems so that we can remind everyone, and as well as the providers, to bring people back. We have worked diligently, as I want to give a shout out particularly to Dr. Davis and his team, because they got the first doses. They will be able to share as hospitals and other providers here in the community are waiting to get their allocation of vaccine. And that is our role. I mean, we really want to be a leader in this vaccine effort, but also reach out and share the vaccine with other providers, so together we can work and cover the state, all rural as well as urban. Again, when I wrote my remarks yesterday, we had 450 providers. We now have over 600 providers signed up. And so I think as we continue, you'll see that there will be providers that are very much anxious to be part of this effort, will be working with us throughout the state, in all parts of the state, rural and urban. And again, given the fact that the 2 vaccines have different logistics and different requirements for storage, we will be able to cover all parts of the states very efficiently. As I said, this phase 1A is healthcare personnel, residents of long-term care facilities, and we will, at the completion of that, roll into phase 1B, which will be non-clinical healthcare staff, pharmacy staff, court employees, nuclear plant operators, the essential workers that keep our state going. But we also are making the recommendation that adults over age 65 with multiple health conditions also be considered during this time. And I think that's so important. I mean, although the residents of long-term care facilities are at extremely high risk, and their staff also will be vaccinated, there are many, many people that perhaps even your own relatives and friends, who are themselves at risk, and older adults, and we wanted to include these high-risk elderly also in that phase 2. Phase 1C will be all older adults and adults below the age of 65 with comorbidities, and we'll continue to roll out these staged priorities based on risk and the CDC guidance, which comes from the ACIP. As we continue, as the governor said, to vaccinate, this vaccine doesn't work immediately. It requires the 2 doses to be fully effective at an effectiveness of 95%, which is extraordinary. Truly, as the governor said, a medical miracle. But we have to continue to practice social distancing, wear a mask, wash your hands, follow the guidelines, because we have to continue to bear in mind that not everybody is vaccinated, and we have to have the whole state be part of this effort for it to be effective and for us to stop the pandemic. On that, I want to just mention again that one of our biggest concerns that I think about a lot is how can I convince everyone in the state that this is safe and effective and a good thing to do. And we do have a lack of confidence in some areas of the state. We have a hesitancy to get this vaccine or other vaccines, and we are really going to work hard with Dr. Davis and his team and other partners, both the business community, the faith community, leaders throughout the state as a whole, to assure everybody that this vaccine is safe, effective, and really extremely important to everyone in the state so we can stop this pandemic now. I think that I've covered a lot of the areas that I wanted to cover, but I also wanted to mention with the holidays coming up, again, bear in mind that we still have increasing rates in the state, and follow our guidelines and continue to take those precautions until we can effectively vaccinate everyone that we can in Georgia. Thank you so much for being here, and thank you for this important celebration of this opportunity to stop this pandemic.
Are we going to do the vaccines?
Yeah, I think we're going to do the vaccines now.
You just tell them that.
Okay, we'll be doing the vaccines now. I think for many of us, and I'm looking at Dr. Watson as well, you know, we've talked about a pandemic, we've talked about taking part in a pandemic flu plan, but never thought we would be so fortunate to be leaders in a position when that happened. And I actually told the governor on the way in that it's a privilege for me to be here today, to have been, you know, fighting with him this pandemic from the beginning, but to see the light at the end of the tunnel.
Carry those.
Thank you so much.
Take that.
Right here.
Ben, why don't you come on this side? Very good.
I've seen it there on TV. I didn't think it would happen. I had no idea it was like, yeah.
Thank you. Thank you.
Really?
They were having this press conference.
I had no idea. Honestly, I was surprised when I walked up and saw truck from Atlanta. Like, oh, you're from Atlanta, we have vaccination lines.
Yeah.
That's crazy. Each of those is a different news outlet.
Exactly.
Didn't start getting ready. Yeah.
Thank you. Thank you so much.
Well, thank you all. Dr. Toomey, you want to come on up? Just want to thank everybody again for being here. Just an incredibly exciting day. Certainly a long time coming, even though... Sorry about that. Let me just repeat that again for our viewers at home. Very exciting day. Thank you all for being here to help cover this so we can get the message out to the people that we have a safe and effective vaccine, and we want to encourage folks as we methodically move through this process. It is going to take a while, but we want more and more people to feel comfortable getting the vaccine, just like these heroes that are our frontline healthcare workers did today, our folks here that are going to be vaccinating, the vaccinators, getting vaccinated from our public health departments. They've all been working very hard, so it's an exciting day for us, and we have a long way to go, but this is certainly a bright start to a different kind of normal that we've been living the last 9 months. So thank you guys for being here. Dr. Toomey and I are available for questions if anyone has any.
Doctor, are you going to try to get you a shot as well?
Yeah, so I've talked about that before. Right now, I haven't. I don't fit in the category of someone to get a vaccine now. That is for our nursing home residents and those that are on the front lines fighting the pandemic, the ones that are most vulnerable. So I'm going to wait to do that. I will tell people I'm very comfortable getting the vaccine as soon as I fit into the category per CDC. I'll be glad to do that to help instill public confidence. My family will as well. And my mother is, elderly. She's in her 80s, and I'm going to encourage, and I know that she will be getting her vaccine as well when she fits into that category.
Governor, people are seeing this happening. Yes, it's going to be a long conversation with the public. How long do you think before your average Georgian will be able to get a shot?
Well, I'll let Dr. Toomey speak to that if she has more information than me. We just don't really know. I mean, we don't know how many doses are coming when. That number has been moving over the last month and a half as we've been planning for this day. We know what we have to work with here the next week or so. We know we're going to get another tranche here in a week to 10 days, maybe 2 weeks, that will help us continue to get the vaccine out. So it's really hard to tell whether this is going to be something that happens in 3 months or 5 months or maybe even longer. So, Dr. Toomey, do you have anything more?
Listen, we are prepared to take the vaccine and distribute it as quickly as we get it, and so the only limitation is the production of the vaccine, which has been slowed somewhat in December, but will be accelerating again in the new year. So we expect, and I think we're hopeful, that we will be able to open it up to all Georgians certainly by summer or late spring. But as we look to essential workers, that's many people who are regular Georgians that we would all think, not necessarily think of them at high risk, but because of their jobs, they are in the public, facing the public, and therefore at higher risk. Or if something happens to them, it could be really damaging to both our ability to carry on. I'm thinking of the electrical workers, the power plant workers, and some of the other workers. So we will be rolling that out, and I think there's probably about 50,000. I think we calculated individuals who fall into that category, or not more.
I just want to confirm, worried about the gap time between now and then.
Well, I think that it is what it is. We are doing it as fast as we can, as quickly. The limitation is just the availability of the vaccine, not our ability to roll it out. And we have been preparing for this for months, literally. And I think there's just, as they become more proficient in production, I suspect we'll even see more vaccine available, and there may be additional vaccines available in the months ahead as well. We will take all safe, effective vaccines. And I just want to emphasize that I have personally looked at the data. I've personally looked at the outcomes. I can't wait to get vaccinated, and so, I will be a very happy role model to, other healthcare professionals who have some hesitancy about getting vaccinated.
Dr. Timmy, I just want to confirm, did you say 84,000 doses are coming to Atlanta in addition to...
84,000 of this particular type of vaccine, the Pfizer, is coming in this tranche from Pfizer. So this was the very, very first amount of that. That 84,000 has already been accounted for.
Did you say the number of those, how many are headed to Metro Atlanta?
They're headed largely to facilities that have those deep cold freezers. So there are some hospitals and healthcare and public health facilities that have them, but not so many in rural areas. So many of the rural hospitals, as well as our rural health departments, have chosen to wait a week or so for the Moderna vaccine. And I expect us to get around 174,000 doses of that vaccine, and that doesn't require that super deep cold freezer. So that will be a lot easier to transport and a lot easier for some of these smaller facilities that don't have as many people to be vaccinated to accept.
And just lastly, can you speak to how you all came to identify coastal Georgia as the place to roll it out versus other parts of the state?
We didn't identify it. The federal organizers of Operation Warp Speed were the ones that told us this is where it was going first.
Let me speak about
Oh, sure.
One of the things I think it's important for Georgians to understand, the way the vaccine is shipped, obviously you could think about the logistics. When they're shipping it from the manufacturer, they're not just thinking Georgia. I'm sure they're thinking, where's the flight going to hit if it's coming by flight? Where's the truck going? How do we distribute it from here to perhaps Florida, perhaps Georgia? And so I think that's probably what is something that we're not necessarily controlling. Operation Warp Speed is doing that. But the doses right now are going to 34 or 35 different facilities. And there are several that are in parts of rural Georgia. These are our hospitals, medical facilities around the state. So people should take comfort in the vaccine is literally going all over the state right now. It's not just Savannah and Atlanta. And we're going to continue to do that. We have the ability, Dr. Toomey's talked a lot about the public health network that we have, whether it's the districts, the county offices. All of these individuals who have been working so hard on things like testing and contact tracing, they're going to be doing the same thing on vaccine distribution. We just got to get to the point where we have enough doses to start getting them out to the general public. But they'll also be helping with our those that have been designated in this first phase.
Governor, what's the message to Georgians who are hesitant about taking this vaccine?
Well, we certainly know that's out there. We've talked about that a lot. I think when you have great leaders like in this community, like Dawn Baker and like Senator Ben Watson that stepped up and participated in part of the trials. I know Dr. Watson was just telling me he's written an editorial in the paper to help educate people on how it affected him and how confident he feels about it. We were just talking about the differences in his mind of the two vaccines. So obviously he like Dr. Toomey, has done a lot of research on this. This is an amazing feat that has been accomplished here in record time with great effectiveness and efficiency for the vaccine. I think the speed of this has also given some people a little pause, saying, hey, do we come to the market too quick? But I think you can tell from today with these healthcare workers, they've been fighting this virus. They know how deadly it is. They know how it affects some people in worse ways than others. and that it's critical for people to get vaccinated because it has been proven not only to work at a very high rate, but also to be very effective. So part of our job and part of Dr. Toomey and I's job is going to be to continue to convince people of that, putting our money where our mouth is. I can assure you I'm going to get vaccinated just as soon as I'm eligible to help instill that public confidence. We're working with other community leaders, people in entertainment, sports, politicians. Dr. Toomey mentioned the faith-based community, the business community, and we'll continue to do that to give people confidence. And I think as we go along methodically doing this, that confidence will continue to build.
Now that this is a reality and on the ground, I don't know who this would go to. Talk about the security of actually physically getting this someplace and the security of all that. How much effort?
Well, I can just tell you, and I'll let Dr. Toomey weigh in on this as well, but we've had the whole task force under the leadership of our Insurance and Fire Safety Commissioner, John King, who's 30 plus years in the National Guard, working with Dr. Toomey, her whole team at Public Health. Obviously, our folks in the governor's office, we've engaged logistically anybody you can imagine in state government that we may need, or even if we don't think we don't need them to move the vaccine around, we're talking to them. National Guard, State Patrol, Georgia Emergency Management Agency. I mean, this is a big logistical lift, not only to get the vaccine here through Operation Warp Speed and what they're doing, but also when it gets on the ground here, especially with the Pfizer vaccine, you have to keep it extremely cold temperatures. It's not the easiest thing to do. And I would caution fellow Georgians to be patient. We know this won't be without trial and error, just like we went through with our testing, trying to find our way, learning best practices. Our folks at the health departments and other vaccinators that are out there, it's going to take them a little while to get in the flow of things, but as we go along, that process will get better. What will be harder is trying to get it to the general public, because it's got to be used within a certain amount of time, trying to schedule the public to do that so you use up every single dose you got. You don't have a bunch left over with nobody to give it to, and so there's a tremendous amount of work to do here. Dr. Toomey, did you want to add anything about the security or logistics?
I think just about the logistics, we really used the flu campaign this current flu season actually, to practice how we might be able to do mass vaccine campaigns, and we were very successful at that, and got many more people vaccinated early on, and I think it's paying off. For example, that we're not seeing much of a flu season this year, at least not to date, and I think that reflects the fact that we were taking that opportunity to kind of practice going into communities, trying to reach as many people as we can quickly, including through the various drive-in sites and other things. So I think the logistics will be challenging, but I think we've been thinking about this for a long time, and particularly as these vaccines, the characteristics and the way they needed to be handled became known, we started training very early.
We've seen over the last week or so some of our highest total for one-day cases of coronavirus. How critical has it been across the state? Are we seeing the hospitalizations going up? Obviously, we're walking a tightrope now, and we have this out, but we still have one.
Yeah, so obviously, we've been talking about this for almost 3 weeks now, going into Thanksgiving, trying to ask people to, do the 4 things for fall that we talked about multiple times today. Limit gatherings to try to, not have a spike after Thanksgiving. I think we're another week or 2 away from seeing exactly what that's going to look like, whether we end up having a spike, whether it ends up being a bump. Right now, we're holding our own. We have seen our cases increase, but we've been in constant communication with our hospital CEOs around the state. We have been working with them as well on staffing needs that they have to make sure we can get through the end of the year. So we feel really good about that. We're also looking at other things that we may have to do in the future. I hope we don't get there, but we'll just have to wait and see. But the point of all this is we need the general public to really help us over the next 2 weeks as we kind of move into Christmas Day and get on the backside of that, to flatten this curve and to help these folks that got vaccinated today and many others around the state that are working nonstop in our hospitals, to help, drive that number of hospitalizations going down instead of just creeping up like it's done over the last 3 or 4 weeks. So that is what we're asking the public to do.
One more.
All right, thank you, everybody.